Hello, this is Dr. Edward Abreu, and today we're going to discuss Mohs surgery. As you know, the sun damage causes significant number of skin cancer, specifically basal cell carcinoma and squamous cell carcinoma. Now, we're not talking about the sun damage that we've had yesterday or the day before. We're talking about the sun damage that an individual will have throughout their lifetime. The majority of the sun damage happens before age 18. Why? We have the luxury both of the time that we can spend in the sun and also the fact that a lot of us will go without sunscreen altogether. If the cancer is on the arm or the leg, it's much easier to treat. Why? Because we go and take a big piece out, and whether you have a scar this big or this big, the final outcome is predominantly the same. The skin cancer gets cut, we stitch the area, we put that tissue in a bottle, we send it out for analysis underneath the microscope with an outside pathologist, and predominantly because we're taking large pieces, the pathologist would tell us, great, everything is out. Now, what if the cancer is on the head and neck area? Then that's when a person like me come into play. What do? We do a procedure called Mohs surgery. It's named after the gentleman, Frederick Mohs, who invented the technique. We numb up, we cut. We do not take a big piece. We literally go outside the area that we see with our naked eye, about a millimeter or two, yay big out, and then that's it. But that means we're kind of flirting with the skin cancer. We don't know whether we have gotten it all out or not. So instead of putting it in a bottle and sending it out for analysis, we do the analysis while the patient waits right here. So again, we numb up, we cauterize to stop some bleeding, we put a temporary bandage on the patient, and we take the specimen to the lab and analyze it. Sometimes we're lucky, we get the cancer from the first time around, but sometimes we're not as lucky. So as such, we have to go back and take a little bit more. And how do we go back and take a little bit more? Well, if this is the cancer and there's still something, let's say left right here, we don't come back at random and cut a huge piece right around the entire area. We purposefully and specifically go to that spot that remains to be positive. So this technique, the Mohs surgery, allows me to be so judicious and frugal as far as how much tissue we take. We keep doing that, so on and so forth, until there is no more skin cancer. Just a friendly reminder, each time we take a tissue layer or a stage, it does take about an hour or so for the analysis underneath the microscope. So we always advise the patient to bring a book or an iPad to entertain them. Sometimes a family member will help as well. Now, once the cancer is done and there's no more skin cancer underneath the microscope, then that's when we come back and see what can we do with the wound that was created by the removal of the cancer. Sometimes we allow it to heal on its own. We call that second intent healing. Sometimes, or the majority of the times as a matter of fact, we put stitches. We do 2 sets of stitching. The deep ones dissolve, the ones on the top, you'll come back typically in about a week or so to get the stitches out. Sometimes it's a couple of weeks depending on the location. If the cancer is in a highly cosmetic area, in a tough area, like eyelids, sometimes nose tips, sometimes the ear, we might have to move the tissue around to close it for you. We call that flaps or grafts. And that means you take that piece of skin either away from the wound site or adjacent to the wound site and try to close it in the most cosmetically appealing fashion. With that technique, with the Mohs technique, there are many advantages. One of them is the removal of the cancer with the most judicious and least amount of tissue possible approach, allowing that to have the best cosmetic outcome. But second, because we're checking the entire margins of the cancer, making sure that everything is out, the chances of the cancer coming back is about 1% or less. That means if we do 100 cases, 99 would not recur, 1% chance that 1 out of the 100 the cancer might recur. For any questions or concerns, visit our website at beaconskin.com, or you can call our office at 248-852-1900.